Earlier today, an older gentleman walked into my clinic with a question. "Doctor, do I have arthritis?" He described aches and pains in various joints. His hands, knees, and legs all troubled him. I asked if he'd had any blood tests done, and he promptly handed me a stack of reports, including standard blood work, rheumatoid factor tests, and autoimmune antibody checks. Surprisingly, everything came back negative. In modern medicine, these tests help us determine if joint pain is linked to rheumatism or autoimmune disorders. Yet this gentleman shared something intriguing. "I'm terrified of the wind and cold weather. If my joints are exposed to the wind, they hurt like crazy. I have to wear thick, padded pants, and I still feel the pain." These are classic signs of arthritis from a traditional medicine perspective. The term, rheumatism, in traditional medicine is a broad one, often encompassing various rheumatic diseases that, in modern medicine, are distinguished as osteoarthritis or rheumatoid arthritis. Despite their shared traits, like sensitivity to wind, dampness, and cold, these two conditions have distinct characteristics. With the right tests, it's possible to tell them apart. Generally, a single blood test suffices. No need to run a battery of them repeatedly. A lot of people ask me if blood tests are the only way to diagnose arthritis. Today, I want to shed some light on how you can differentiate between rheumatoid arthritis, and osteoarthritis without solely relying on blood tests. First, the root causes of these conditions differ. Osteoarthritis is often due to wear and tear on the cartilage, leading to a loss of elasticity and eventual erosion. Rheumatoid arthritis, on the other hand, is typically an autoimmune disorder that can occur after other illnesses or due to genetic factors. Its onset mechanisms are complex. Second, the typical age of onset varies. Osteoarthritis is more common in those over 50, with a higher prevalence in women, while rheumatoid arthritis often appears in people between 30 and 50. Third, the joints affected by each condition can provide clues. Osteoarthritis tends to target high-use joints like the knees and hands, while rheumatoid arthritis commonly involves smaller joints like those in the fingers, knuckles, and wrists. Fourth, these diseases impact the body differently. Osteoarthritis usually confines itself to the joints, while rheumatoid arthritis can affect organs like the lungs, liver, and heart. There are a few other telltale signs. If your joints are stiff when you wake up but start to loosen up after a bit of movement, it's likely osteoarthritis. But if you need to move around for over 30 minutes before the stiffness eases, that could be a sign of rheumatoid arthritis. No matter which condition you're dealing with, it's important to stay warm, avoid cold wind, and steer clear of getting wet with cold water. If joint pain strikes, consult your doctor and follow their advice to keep symptoms in check. If you found this helpful, don't forget to share it with others who might benefit. I'm Dr. Mai, and I hope these insights help you navigate the complexities of arthritis. Follow me for more health tips and ways to take control of your well-being.